Wellways is a carer program for families and friends of people who have a mental illness. There's programs all over Australia.
For people who've never heard of it, what do you basically do?
Okay. It's based on some really big words: biopsychosocial model of recovery, stress vulnerability coping models. They're really big terms, but what it really boils down through the 8 weeks of the main program, we actually allow people, the families and friends, to understand how illness is diagnosed and how it is treated. And from that, the understanding of their own grief and loss will come through, effective communication, so that the families can actually learn to communicate with their loved one, their extended family, who sometimes they lose through this journey, and also the professionals. And then we allow them to know where the services are, which will help them so that they can stay strong, but also that they can actually help the people that they're supporting.
Does having an active and informed family or carer support network help you to improve your physical health? And if you believe, you're nodding madly, so you clearly think it does. Give me an example, perhaps from your own life. I think you're a mother of a son with schizophrenia. Give me an example how you've been able to help improve the physical health of your son.
Some 22 years ago, when my son was diagnosed with schizophrenia and we lived in the country 500 k's from any services, so I know what it's like not to have services in your backyard. I always thought everything would be wonderful in the city. It doesn't mean everything's perfect. So everywhere in Australia, we're on the same page. But the most important thing was when I actually learnt and find out what the services were, to learn how the system worked, and then to actually advocate for change in my particular area was very, very important. And it's the responsibility I see in some aspects for families and communities to get together and actually be supportive of each other, as was talked about in our meeting here this morning, to in actual fact engage with the community and try and change the services through your, not only the professional system, but through your government member.
Janine wanted to know if we could get some comments from here about how people get started getting information about their mental illness. She has noticed a neighbour who's not connected anywhere and seems to be very socially isolated and doesn't know how to get started with offering that person some support.
As a support person, it's difficult to support someone else who may or may not want help. People can go to the MIFA website, which is www.mifa.org.au, and from there are a bunch of different links for consumers and carers, so that's a good starting point.
Sydney Health Fellowship has just got funding through the NIBS Foundation, which has been running without funding for the last 10 years, Beyond 5 program. Now, there's equivalent programs for that, funding that's allocated to children of people with that have parents with mental illnesses between the ages of 7 and 17, and that's actually under the auspice of the Schizophrenic Fellowship. I know it's patchy in New South Wales. What it's like in other states, I don't know. But there's workers there who are employed, and what they're there to do is assist parents to be the best possible parents they can to keep the children in their care. So I've written all the sorts of things that I expected people would raise today about what improves your physical health: a good relationship with your general practitioner, a group to do your exercise with, do not smoke, monitoring of the risk factors, for example, overweight, eating too much, not moving enough, reviewing the medication, support from friends, peer support, move more, eat less, family and carer support, self-respect and advocacy for yourself. We've talked about social connection, we'll talk about work in a moment, friends, and raising physical health as an issue with your doctor.
We are literally all there we're being paid to provide you with services, and you've got to ask for them. You've got to say, I deserve as good physical health as anybody else.